Okay, if you're suffering from lower back pain, and an awful lot of people are, you often can end up finding a chiropractor to help you treat your pain. Well, now there is a manipulation called spinal manipulation and alignment, and it can help with that pain, but you might be going about it the wrong way. So we're so happy to welcome back chiropractic orthopedist Nick Circolone and his nurse practitioner Julie Carr from Apple Chiropractic Orthopedics and Rehab over on Shallowford Road. Good to see you.
It's good seeing you, Julie. It's always great being here.
I'm interested in this one because I happen to have lower back pain. Junior year of high school, fell down 18 stairs and messed myself up. But you said that a lot of people who suffer from it go to different places looking for the answers,
right,
and they end up not really getting the right treatment along the way.
A lot of they're getting the treatment, but sometimes it's not cohesive enough. So what we're doing is we're incorporating rehabilitation with spinal manipulation, with spinal decompression, and we're having them do passive activities, active activities. We'll actually have people riding a bicycle before we put them on the decompression table. Once they're off the decompression table, then I'll get in the gym with them and we'll actually do exercises together, show them how to do things. So what happens is they're not only relaxing before the treatment, but following the treatment, we're rehabilitating it. We're not waiting 2 or 3 weeks to rehabilitate. We're rehabilitating right now.
This happens all in the same visit.
Yes. A lot of times, like right now, what you'll see is patients are going on a decompression unit. After they come off this unit, what will happen is we'll work in the gym together and I'll have them doing some active exercises with weights, and then following using the weights, we'll actually do some stretching, some basically core kind of exercises to help stabilize those areas. And what happens is these patients get better faster.
So, okay, the first thing has to start, I guess, with an evaluation,
Absolutely.
Right? And then once you know what you're dealing with each individual case, Julie, and I know you're involved with this too, as the nurse practitioner, you are going to have to allot about how much time for each visit?
Well, it depends. Usually it's probably about 45 minutes to an hour.
That's not that bad.
Yeah, no.
To walk out of there having had the total treatment that you need. Do you tend to see, you mentioned a speedier recovery, is there kind of a standard of how long people tend to go through treatment with this new approach?
You know, it all depends. What we do is we try to block patients. We block them in like 3 to 6 visits, see how that works in there, and we change it. What's nice about our facility is we're able to change things. People are dynamic, they're ever changing.
Yeah.
So if they're doing better doing this, well, we'll add more of that. If they're not, we'll take it away and add something else.
Okay.
And Julie being there adds the medical component to us. So that helps a lot as well.
Because there could be a situation where someone needs more than just the treatment, but some medicine to maybe get in and deal with inflammation and that kind of thing?
Exactly.
Okay, talk about this. A lot of us will complain about, oh yeah, I got lower back pain, it's no big deal. If you don't treat it though, it can lead to a big deal.
Depending on what's causing it. Sometimes balance issues, if the body is not in balance, if there's no homeostasis, what'll happen is we'll set ourselves up for injuries, and that's when people have low back pain. So if you're having some issues or discomfort, there's something else going on, and we don't want it to get to that point where, hey, maybe we have a disc issue and we have to do a lot more things.
This is not an easy question to answer quickly, but here I go anyway. I overheard a conversation with you at the station this morning. Somebody heard you were a chiropractic orthopedist. The question was, well, what's the difference? How do you sum up the difference in what you do than what a standard chiropractor does?
The first thing is I went back to school postgraduate after my chiropractic college, and I got a 3-year postgraduate degree with a diplomate, which means I actually took a national board to take it. What we do is we take chiropractic, we take the orthopedics, and we kind of blend them together in order to get the patients better. We use manipulative therapy, we use rehab, we use physical therapy modalities in order to get a holistic or a more comprehensive approach to patient care, and they get better faster. It's just the way I look at things differently.
Okay, for people out there who maybe don't have lower back pain, but they have maybe some neck pain or something like that, isn't your spine designed so that it essentially shifts itself to keep your eyes level so that you can have problems and not really even realize how severe?
It does do that. And with my orthopedic part of my practice, what we do is we're looking at the whole body. So we'll start at sometimes we'll do your feet, ankles, knees, hips, low back, looking at that all the way up the line in that kinetic chain to find out what's causing that problem. Because sometimes a foot issue can really be related and causing neck problems. So we have to look at everything, the whole body, not just parts of it.
It's the true trickle-down theory.
Absolutely.
All right, go find him. He's still in the same location. His name has just changed to better showcase for you what it is that they do there. Apple Orthopedics and Rehab. Is that close enough?
That's close enough. Chiropractic orthopedics and rehab.
Chiropractic Orthopedics, I'm sorry, and Rehab on Shallowford Road, right out there by the Hamilton Y. So if you hurt yourself at the YMCA, just walk across the street and see Nick and Julie, 855-7376, and it's still applerehabgroup.com. Thank you.
Thank you.
We're back after this.